Professor Hosten, what are the benefits of population-based studies?
These days it's not easy to get a radiological study reimbursed. And the reason is that the standards, what the insurance companies want us to present to show that our studies really are of benefit to the patients have been raised. And if you look at a patient career, the radiological exams are done somewhere in between them. And most medical studies have to prove that the diagnostic or therapeutic things you do improve survival of the patient. So if a patient lives for 5 or for 6 years after his diagnosis, how can you tell that a radiological exam that he had in the first year improves survival? So new ways to prove the benefits of radiological exams has to be found, and population imaging is one of them. In population imaging, we go back if a disease is diagnosed, we look at the study that was done years before and look if we can tell from that study what disease the patient will develop.
So you have set up a project, can you please describe that?
In Germany we have the so-called national cohort. The national cohort consists of 5 MR images of 3 Tesla. They are in different cities, and each of these centers will image 5,000 patients in the next years. And the patients are also subjected to medical exams. How's their health? What problems do they have? And these medical exams are repeated during the next years or during the next decades to see how their health is developing. And the medical images, the MR images, are part of this examination.
So that's a multi-center approach?
That's a multi-center approach, that's right. Yeah.
Who all is participating in that?
There are different cities, like it's Munich, there is Berlin, Greifswald, where I come from, and other cities.
And what are the indications that you're looking at, the conditions?
We do a whole body MRI, and the people that we image are healthy subjects. They don't have any disease. That's a revolutionizing thing, and we can do that because MR imaging has no ionizing radiation. So there are no side effects. We can image people, and we are very curious what it's like here.
So what results are you expecting at the end of this project?
I think one benefit will be that we have a much better understanding what's the difference between a real disease on MRI and just an incidental finding, something that you find that doesn't look completely normal, but it's not a serious disease that has to be treated.
And if results are promising, would you think that at some point in time there would also be the potential of hybrid imaging projects like this?
Yeah, there you have the ionizing radiation to think about, but of course there are other imaging studies apart from MR that are promising and interesting.